Assalamualaikum and a good morning. Htil at UKM, where healthcare meets technology. Htil stands for Health Technology Innovation Lab. I would like to start off with telling you why the concept of Htil is important. This is concept promoted by the government of Japan called Society 5.0. From a hunting and gathering society 1.0 to agricultural society 2.0 to industrial society 3.0 and information. Assalamualaikum and a good morning. Htil at UKM, where healthcare meets technology. Htil stands for Health Technology Innovation Lab. I would like to start off with telling you why the concept of Htil is important. This is concept promoted by the government of Japan called Society 5.0. From a hunting and gathering society 1.0 to agricultural society 2.0 to industrial society 3.0 and information society 4.0, we are now advancing into Society 5.0, which is a human-centered society that balances economic advancement with the resolution of social problems by a system that highly integrates cyberspace and physical space. So this is what Society 5.0 should be about, whether it's a social problem or a physical problem or a cognitive problem. You consider it being able to be solved by using the principles of Society 5.0. In other words, you use the progress in science in order to solve the problems in society. The current society is called Society 4.0, which is an information society. And as we move to Society 5.0, which is all about big data, artificial intelligence, and the interaction between cyberspace and physical space, we hope to be able to solve problems in terms of reduction of burden, optimal treatment, health promotion, and end up with comfortable living for all members of society. So this is where health technology innovation is important in order to bring about this change towards Society 5.0. So the sort of tagline of Htil is a melting pot between healthcare and technology to give birth to innovation. This is the venue where we have first been given to operate. This was in the nurses hostel, level 3. But right now we have just moved to this newer location, well, not so new to the faculty, but new to us at level 4 of the preclinical block, so much more comfortable. So you can come and visit us there. The idea of Htil was first mooted in 2006, and the group moved initially in cyberspace. Several innovative medical items were developed, for example, the Pelvic Immobilizer, HIREPS, the Hospital Integrated Resuscitation Pendant System, Hitman, and IoT for vital signs monitoring, together with the Faculty of Engineering and Built Environment in Bangi. Recent developments that we have ventured into medical VR modules with installation of the Vitalis Active Move, the equipment or big screen that you can see in the picture just now. Artificial intelligence in the pathology interpretation of slides. This is in collaboration with Kite UKM, and big data in customized fetal growth charts in collaboration with the Parental Institute of the United Kingdom. And as I've mentioned, we've now secured a space, alhamdulillah, to operate as a physical location since last year. Now, commercialization is a very important aspect of health technology innovation simply because we need that industry collaboration to speed up matters and to facilitate commercialization. Because without commercialization, your innovation will just sit on the shelf and nobody's going to make use of it. And it is also important for reinvestment for future research to keep the research going on, where you go from version 1 to version 2 to version 3 of your product. So this is one of the success stories of Hdil, the Tracheal Pelvic Immobilizer. The products are not without any evidence to back it up, like this one. A cadaveric study was done to test its functionality. And this is what it is now, marketed by this company called Trinovate. And these are our vision, mission, and values in Hdil. Our vision is that Hdil should be a pioneer in translating ideas from the bench to the marketplace. This is what we aspire to be. Our mission is transforming ideas, fostering innovation, and commercializing healthcare technology. Our values, in order to move towards that, is innovation, creation, collaboration, commitment, and commercialization. You can abbreviate that to I4C or I4C. This is the scope of activities of Hdil. Virtual reality, drone technology, big data analytics, Internet of Medical Things, and artificial intelligence. The organizational structure is such. The deputy head at the moment is Associate Prof. Dr. Gan Kok Bing from FKAB. And we have quite a number of project leaders in various fields, particularly VR, mobile apps, smart isolator project, and the drone project, and another mobile apps is My Mums, which is under myself and Prof. Rosna Sultan from Public Health. So working across borders, as you can see, all those people who are listed here are from various departments as well as various faculties. So it is not only cross-departmental, but also cross-faculty. So that is the culture that we would like to inculcate in members of Hdil, to be able to work interprofessionally across boundaries. This is our drone in healthcare project. The objective of which is initially was to evaluate the feasibility of drone usage for transportation of blood samples and blood products in a tropical climate. And we have moved on from there to look into other more technical aspects of the drone as well. This is the timelines of our drone journey, starting from 2018. As 3 projects under one program, which received Dana Cabaran Perdana from UKM. And then in 2019, we actively collaborated with the Aerodyne Group. And subsequently, in 2020, Alhamdulillah, we managed to get another grant, which is much bigger than the Dana Cabaran Perdana from CREST, 660,000. And this is headed by Prof. Rosdiadi from FKAB now, but some of us are members in that group as well. And subsequently, we developed the blood ordering system, which is an app developed by Project 3. So these are the leaders of the 3 projects under the program. And these are some of our team activities: simulation flight in the Cyberjaya Aerodyne campus. Aerodyne was kind enough to let us use their flight area and their drone. And we had meetings even at the Aerodyne headquarters in Cyberjaya as well as in Cheras. And we visited their workshop. This is another project that we have, My Mums, in collaboration with Mersiniaga, the Malaysian Obstetric Monitoring System. You can look this up in the Mersiniaga website. It is published there. And these are the timelines of our work with Mesiniaga. We started off just as MCO started to kick in 2020. And by 2020, mid-2021, we started beta trial of the apps in HUKM, and subsequently, we collaborated also with USM as well as UIA. And currently, we are looking at starting beta trial in the KKM Health Clinic or Klinik Kesihatan in Penang. This is what the dashboard of my mom's look like from the healthcare worker side. You can see a patient summary card, antenatal module items, postnatal module items, consolidated patient information, appointment widget, kit count widget, and there's even a doctor private notes if you need to jot down something that is confidential and that should not be seen by the patient, for example. You can put it down there. The good aspects of this is there is a list of health problems right on the dashboard in front here. So if the patient is GDM or 2 previous CAR or previous preeclampsia or active preeclampsia now, whatever, or group B streptococcus positive or HIV positive, whatever, you can write it all here. Okay, and whatever lab test results that has been done, not traced yet, you can also highlight at the front here so that the next person who sees this patient does not miss it. This is what the patient will see on her smartphone. Again, a patient summary card, summary of the medical history of the patient, the list of lab results that she knows the doctor will need to trace, and there is an appointment widget, and this will actually send out an alert to the patient 3 days before the date of the appointment. And there is also a kit count widget here for the patient to enter the fetal kit counts. And of course, here you have all the last menstrual period, EDD. If there is an REDD, that will override the EDD. Okay, the parity of the patient, the color code according to the KKM color coding. Now, you even have a venous thromboembolism risk scoring, okay, added here as well, and automatically calculated once you have entered all the risk factors. Okay, so and if the patient is postnatal, what day postnatal is she? Okay, and there is a Q&A that the patient can enter down here in order to ask questions, ask the doctor any or healthcare provider any questions. And currently we have 200 plus patient users in UKM, 100 plus in USM, and about the same number in UIA hospital. And this is something that we would like to incorporate into my mom's. We are in the midst of working with the Perinatal Institute on this, the Grow My function. Grow My is a customized growth chart for the fetus, which is adjusted for the maternal ethnicity, maternal height, maternal weight, maternal parity, as well as maternal age. So every single pregnancy, not only every single mother, or every single pregnancy, meaning every baby will have his or her own customized growth chart. And once you've entered all the particulars that need to be entered, the parameters in the system will automatically generate the growth chart peculiar to that particular pregnancy. You will be able to see in a few seconds here. Okay. So voila, that's the growth chart that is specific for this particular pregnancy of the mother. Right, so other aspects that we deal with in HTIL, as I've mentioned just now, virtual reality. We have developed a few training modules, one in cataract surgery, foot and ankle surgery, one in disaster response, and two others are in progress, maxillofacial surgery and obstetrics and gynecology, particularly normal delivery. And we hope to be able to use these for teaching and learning. And there are therapeutic modules as well that we have developed or in the midst of developing in collaboration with psychologists and social scientists. One on autism, social skills training, obsessive compulsive disorder, specifically the CBT module, cognitive and behavioral therapy module, in virtual reality mode. And another one, which is on the verge of being experimented at the moment, is pain relief in labor. And apart from that, we can also customize virtual surgical planning based on clinical needs. So the products that we target are products which are for niche market and customizable. That's the beauty of being able to develop healthcare-related technology on our own, on local ground in our own country. You know, we are in touch with the people who developed it. Therefore, we are able to customize it according to our own needs. Okay, whether it's clinical needs or cultural needs, whatever. And it should be functional and hit the local or regional needs. It should be scientifically sound and evidence-based, and it should be authentic, designed with the help and input of experts in the field, in the specific field. And for the future, we hope there'll be a continuous cycle of research, commercialization, and reinvestment into research in a multidisciplinary manner with the industry, creating capacity building of future generation of researchers, whether it's researchers in the healthcare area or the technical area. And commercialization, as I've mentioned, is very important. Building subject matter expert industry trust and reliability as well as tolerance. So in summary, multidisciplinary collaboration across borders is the way forward towards achieving Society 5.0. Modern healthcare can only progress through working hand in hand with technopreneurs or industry players and experts from other fields, including engineers and social scientists. Commercialization is the channel through which innovations can benefit society in a sustainable manner, accompanied by progressive improvement and product enhancement. So these are some of the places where we have been featured in our own RESMI or Research Medicine Innovation Bulletin under the Faculty of Medicine. Htil was featured there. Internationally, we've been featured in the Nest Garage by Leave a Nest, which is a researcher company. You can see there, Htil. And we have also inked an MOU with Leave a Nest, which is a Japanese company, recently. And under Leave a Nest, there is this Tech Planter program, which aims to promote innovators in healthcare technology. So if you're a healthcare technology innovator, you can actually make use of this platform in order to get your product commercialized. It's under Leave a Nest. And where can you find us? In the Faculty of Medicine website under the Secretariat of Research and Innovation. Okay, you'll find this page, and under Population Health, you'll find this blue button, which is an active button. You can click on it and reach this page with all the details of who we are, what our objectives are, and how do you join us. Okay. And last but not least, before we end, I would like to play this short, corporate video of Htil, if you like. Okay, developed by Dr. Hisham, one of our members. So here goes. Okay, so thank you very much for your attention. And we most welcome you to join Htil if you have common interest with us.
Okay, thank you, Prof. Zaleha, for this presentation.